House Media Group podcast with our host, Dr. Jim. Dr. Jim, we're finishing up the series, and we're really gonna dive deep into a subject matter that I think definitely needs the future of pain management. Pain management has changed a lot in the last decade. What would you say are the biggest shifts you've seen, and where do you think we're headed in the next 10 years?
Well, I believe, there's been a real strong emphasis on some of this stem cell replacement and the PRP type focus, where in essence they are extracting, blood or plasma from one area of your body that seems to be very functional and not ridden with inflammation or maybe not degenerative in within the context of a joint, and they're actually injecting that into the area of concern. Usually, Neil, it's going to be a shoulder or a hip or a knee, and what they're trying to do with that is they're trying to be as conservative as possible in regards to what's going on with the integrity of the joint. So they're really trying to do everything they can. A good surgeon will integrate that. A good orthopedic surgeon will really keep those options open for the patient. And they'll say, okay, matter of fact, I've got a great example. I've got a lady, she's probably a 72-year-old female, and she was a gymnast when she was younger, and she had an injury, and it had locked her hip up partially for an extended period of time, for many years, since she was probably in her 20s to the time where she's at now at her early 70s. And I worked with her with the dry needling and the ultrasound, and we did some. She had been back and forth to physical therapy, with marginal improvement, because what had happened over all those years, we talked about how a lot of the myofascial chains, they get adhesed, and a lot of these muscles and connective tissue, they stick to one another, and it had locked this lady's hip down, pretty bad. So she was one of these very, other than that, great health, in good shape, exercised a lot, but just frustrated because she was beginning to have more and more hip pain and more groin pain. So I told her, and she trusted me, explicitly, with, because I'd helped her before with some other issues, and so she just was completely open to what I had to say. So we worked on this hip off and on, for a couple months, and then I just told her, I said, look, I think you need a fresh MRI on this hip. I don't think she'd had one in many years, and I think we got a problem with it. So there's a great orthopedic hip doctor in this town, and he does the robotic surgery, and his wife's actually a doctor too, and she does all the preliminary stuff. So I sent her that way, and come to find out, she's got a really bad hip. A lot of loss of cartilage, bone on bone, this kind of thing. So what this particular doctor did is what I'm, getting around to here with the stem cell and the PRP. We're gonna do those things with her first and foremost, to see if that helps, and to see if it moderates some of her pain. And the next step will be, if this doesn't help or make a significant impact with her mobility and her pain level, she's going to have to get a hip replacement. Now, in her case, this particular lady has some sensitivities to metals, so that makes this, the preliminary setup for this joint replacement a little bit more challenging, because they're going to have to do these tests on her to find out if titanium is going to be a workable material, or if she's going to have something else that hopefully she won't be allergic to. But in that case, I think we're going to, going forward in the future, you're going to see a lot of these, knee and shoulder and hip replacements, where these doctors are going to try to be very conservative, and they're going to try to administer some of this new technology with the PRP and the stem cell, and see if it makes a difference. If it doesn't, the joint's completely wore out, then we move on to the replacement. So that's one area that I've seen in the last 10 years, really broaden, Neil.
No, it definitely has in so many ways. Do you believe the future is moving away from medications and surgeries toward more natural, non-invasive body treatments?
I do. I really do. I think with the advent of new supplementation, uh, dietary changes, uh, different types of exercise routines. More people are open to a lot of these Eastern exercise regimens, whether they be, we started years ago with some of this Pilates stuff. We've moved on into, with older patients, particularly some of this Tai Chi and certainly yoga. All this kind of stuff can be extremely beneficial in prolonging any type of back to what we talked about just a minute ago. Let's say, for example, joint replacements. So yes, you're seeing a lot of that, and I think a lot of that is very effective. So yeah, I think people have been pretty broadly discouraged with what we've talked about in our previous episodes of the whole protocol, where they run down a lot of different rabbit holes, and they just don't get the proper relief. And so therefore they're way more open-minded to trying different things, like lifestyle changes, dietary changes, of course, drinking more water, different types of exercise and stretching regimens. Um, you know, the future is really, really bright when it comes to a lot of this stuff, and we're seeing a lot of different things open up, and probably within the next 5 years, I think more and more options are going to be available for people that are going to be non-invasive, and backing away as much as they possibly can from surgical intervention.
Yeah, absolutely. I think we're getting there for sure, and we're getting closer and closer in so many ways. Um,
Absolutely.
so do you technology is exploding in healthcare. What new tools from diagnostics to treatment techniques excite you the most for pain relief?
Well, I feel like CT scans and MRIs with contrast uh, are are particularly MRIs with contrast a lot of times are neglected, and with that contrast dye is some people do have some significant reactions to that, but when the dye is applied, we get a much better, broader view, and a detailed view too, of what's going on within the context of the area. And so that, I think you're going to start seeing better technology with some of these diagnostic tools, like a CAT scans, and like 360 CT scans, and some more high tech. Of course, we have open MRI machines now, because a lot of people are kind of claustrophobic and have problems with that. So I think you're going to see a lot more of detailed and very advanced technology in regards to some of these machines that diagnose. So I think that's number one. Number two, I think you're going to start seeing more integrative doctors added into the mix, like myself, because unfortunately we're inundated with pain and pain conditions, and a lot of these family doctors and general practitioners are filtering patients out, and before you know it, they're going to these specialists, and some of them are really just more concerned with volume rather than rather than being detailed with the patient. So they're really not giving, and we've touched on this before, they're really not giving the patient the adequate amount of time to decipher what exactly is going on. And so when that happens, we go back to what we discussed previously, where patients end up going down these rabbit holes without any significant relief. Well, then they begin to step outside the realm of conventional medicine. A lot of patients, chiropractic has been a mainstay in America for 100 years, so that's kind of tried and true. But there's a lot of misconceptions with chiropractic, and there are a lot of fallacies. But there are some patients that I see will walk in here and say, I'm not going to let a chiropractor touch me, because of
Right.
whatever happened, with maybe a family member or a friend. So, they're looking more into this Eastern approach, whether it be dry needling or physical acupuncture, this kind of thing. So, massage therapy, exercise, stretching. You see these stretch zones that are very popular, Neil, and I think they're really good. And it just depends on the therapist, because a lot of patients that I see that will go to PT and things actually get exacerbated. They actually say, okay, well, I'm gonna try the stretch zone. They go to the stretch zone, and these people take their time with the patient. They're a lot more detailed in what they're working with, and they seem to glean a lot more positive results from that. So those things you're seeing popping around, whereas 10 years ago you wouldn't see that kind of thing.
No, you would definitely not see that kind of thing, and it's a surprise in so many ways. So let's how big a role will patient education play in the future? Do you see patients taking more ownership of their pain instead of waiting for someone to fix them?
Tremendous, great question. Well, with the advent of AI, obviously we've had WebMD and we've had Google, and there's all kinds of information on YouTube out there. Now, again, it's a little confusing to some patients, but you know if they're able to have a general idea of their health condition, and they feel like where they've been seen previously with these doctors have yet to help them. The internet and AI, I think, is going to be instrumental in guiding them and giving them a little bit more gravity to take ownership of their own health concerns. And I think you're seeing telemedicine is, particularly since the advent of COVID, has really become a big thing. We have a big older baby boomer population that is still a little reluctant to get out there because of immunocompromised type situations since post-COVID. So they're relying on telemedicine and telehealth. So that is going to, I think, expand itself over the next 5, 10 years. And to me, I think that's a good thing, because unfortunately, when you go to an emergency room or you go to a hospital, as clean as it can be and as sterile as it can seem to be, sadly, there's a lot of pathogenic stuff floating around some of these doc-in-a-boxes and ERs and hospitals. And people have gone there and they've had procedures and they've come out and they've caught some funky stuff like MRSA and this type of thing. So some of these patients, and these older patients particularly, they've seen this kind of thing, and they're a little apprehensive about waiting in an emergency room, waiting room for hour, hour and a half, 2 hours, rather than saying, okay, you know what, I'm going to talk to my daughter-in-law who's a nurse, and she's directing me to go to WebMD or to AI, or this particular natural doctor's on YouTube, and he's laying out a supplemental program that work for, say, some friend of theirs at church. And you're seeing a lot more patients take ownership of their health, beyond what the conventional apparatus is currently.
All right, so let's go to the next question on the list, and that involves, as treatment becomes more personalized, how do you see practitioners balancing science, technology, and intuition when working with patients?
Yeah, I think uh, doctors, traditional MDs and DOs, over the last, I would say, since COVID, or maybe even a few years prior to that, they've been a little more open-minded about some of these younger doctors, particularly about more integrative approaches, and they're sort of loosening their reins in regards to patients and saying, hey, why don't you try this? Or the patient will come in and say, you've helped me with this medication, but it's we've sort of hit a plateau here. We've hit the wall. And do you have any other suggestions? I know, uh, a family member that went to this particular naturopathic doctor or this integrative doctor. And of course, they're doing hormone replacement, or they're doing, PRP, or they're doing minimally invasive surgical procedures that are beyond the scope of what your standardized approach would be. And you may want to open up and try this. Some of these laser therapies have worked with patients, others have not. But a lot of these doctors have loosened the reins on on referring or being open to a patient suggesting some of these types of therapies. So going forward, I think you're going to start seeing much more of an integrative collaboration. I may have mentioned before, I've had a 5, 6 year kind of relationship with the local hospital here. And this local hospital has medical students that come from the Medical University of South Carolina down in Charleston, 3rd and 4th year students. They have an integrative elective course, and that encompasses, what I do, maybe even what chiropractors do, uh, a lot of other kind of extended therapies. I think you're going to start seeing a lot more cryo therapies, sort of added to the mix here. Certainly, laser and TENS type therapies, ultrasound therapies. These are all going to start being more prevalent going forward.
Now, this is the big question. This is because we're closing up our final question of this podcast. And I can't wait to have you back on later next year in 2026 once the book
Okay.
comes out to talk about it. But your book ties all of this together. How does it help people prepare for this new, more modern approach to pain management?
Yeah, I think people are still going to have to the majority of people, let's say, are still going to, and I can only base this on my little insulated bubble. So, I am from a region of the country, I'm a Southerner. Um, I've grown up in this area, and sort of the mantra has always been, with my age range and older, that the doctor is almost infallible. The doctor knows as close to what God knows as anybody. I even remember as a little boy, my grandfather, he was an immigrant from Greece. They had, country doctors, family doctors that would come over and do house calls back in those days. I don't remember that myself, but I remember my grandparents talking about that and how much they really, trusted and adored those doctors. And of course, those days are over, but still regionally in the U.S., I still think that that's kind of a mainstay. So I think we're getting beyond that, Neil. But I, within my little bubble here, you still have patients that go to the doctor, and if the doctor prescribes a medication, I would say north of 90% of the time, that patient's going to take that medication. Now, are these doctors making sure that they are covering all bases and realizing that there could be potential contraindicated side effects with a lot of these medicines? Like we talked about before with prednisone and steroids. Steroids can be phenomenally effective for a lot of things, but, and a big but, it is that you have to understand the metabolic situation with a lot of these patients because if they have a blood sugar problem, the steroid injection could be super dangerous. So back to what I was saying here, I think that culture is changed, particularly in my neck of the woods here. And I think one of the main things that made that change was the advent of COVID-19. COVID-19 put a lot of distrust in the conventional medical establishment. I mean, it was glaring, it was stark when it happened, and I saw a big switch because a lot of people died. A lot of people got sick. A lot of people retained long COVID. A lot of people had reactions to the vaccines. So where I'm at, where 20 years ago, doctors were like, gospel, and then once COVID came, doctors were being looked at with a jaundiced eye.
Hmm. All right. So it's really interesting. People can find information on you. Cannot wait to see the book. Then you'll come back on the show again. And we'll
Absolutely.
be in 2026. We'll figure out how we're going to market the book and market some other stuff. But best place we can find info. Where can we go?
Yeah, drjamesacupuncture.com or communitynaturalhealth.net. And feel free to shoot me an email and I would love to respond.
All right. That was a special sound.